It's got to be so frustrating when you've tried all the usual medical routes and you're not seeing the progress you'd hoped for,
Especially.
or especially when it's someone you love.
Especially when it's someone you love.
I mean, you just feel like,
Oh.
are there any other options out there?
Yeah.
Well, that's what we're going to explore today.
That's where AI comes in, right?
Exactly. AI is so powerful in medical research because it can sift through a huge, a truly overwhelming
A
a mountain of data.
of information, yeah.
Yeah.
That a human mind just could never do.
Right. And so, in a way, it can be like this incredibly well-informed
Consultant.
consultant or researcher charting paths we might not even know existed.
Exactly.
So today we're taking a deep dive into a really personal challenge, and I'm so glad you reached out to us about this. You're looking for insights that could help your wife's health.
Yeah.
She's 60, you said she's petite, and she's been dealing with a number of persistent issues since having a tumor partially removed. And despite ongoing medical care, she's still experiencing weakness, sickness, vomiting, and just hasn't seen the improvement that you're hoping for.
Right.
And I can only imagine how concerning that must be.
Yeah, absolutely.
Yeah.
I mean, to really understand where the AI is coming from and the suggestions that it's making, we need to understand the medical picture a little bit better.
Okay.
So the diagnosis is a meningioma, and it's situated near a very critical area, the brainstem.
Okay, so for those of us who don't speak medicalese,
Exactly.
what is a meningioma?
So a meningioma is a type of tumor that grows from the membrane surrounding the brain and spinal cord.
Okay.
Now, these are often benign. They're not cancerous,
Okay.
but the location near the brainstem is really the problem here.
Oh, I see.
So the brainstem controls essential functions like breathing and heart rate and balance.
Oh, wow.
And so even if they're not cancerous, even a partially removed tumor can have really significant effects when it's near the brainstem.
So it's the proximity to the brainstem that's really the crux of the matter here? That explains why, even with part of it removed, it could still be causing such widespread problems.
Exactly. And the medical report has a number of neurological findings that really underscore that impact.
Okay.
So the first one is right-sided facial paralysis, or what they call in the report physialis brevis retz.
Okay.
And that indicates damage to the nerve that controls the muscles on the right side of her face.
Oh, wow.
So you can think about how that affects things like closing her eye, properly smiling, or even the mechanics of eating and speaking clearly.
Right. So things that you and I probably take for granted could become a real challenge for her.
Right, exactly. And there's some other neurological impacts as well.
Okay, what else is there?
So there's rotatorischer nystagmus, which are these involuntary rhythmic eye movements.
Okay.
And that often makes the world feel like it's spinning. And so that leads to persistent dizziness and balance issues. Right, so that's
Yeah.
a big part of what she's experiencing.
Okay.
And that's further complicated by what they call gangstorum,
Mm-hmm.
which is basically difficulty walking, and fallnagum, which is an increased risk of falls.
Right.
And so all of these are kind of interconnected consequences of this brainstem involvement.
It all makes sense.
Yeah. And then also there's hearing loss, or what they call hypoacusis.
Oh, wow.
That's also reported in the report. So you can see it's a number of different challenges that she's facing, all stemming from this tumor near the brainstem.
Wow. So you've really painted a clear picture of the physical struggles that she's dealing with. And the report also touches upon her mental and emotional state as well, right?
Absolutely.
Yeah.
So the psychiatric findings section mentions depressive Stimmung, which is a depressed mood.
Yeah.
It also notes verlangsamtes formales Denken,
Okay.
which is basically a slowing down of her thought processes.
Got it.
And then Auffassung, Aufmerksamkeit und Konzentration, rasch erschöpflich, which basically means that her ability to understand, pay attention, and concentrate is easily fatigued.
Right. It's exhausting.
Yeah, exactly.
Yeah.
And so these cognitive and emotional aspects are often intertwined with neurological conditions,
Of course. Yeah.
right? And can really significantly impact her overall well-being and her recovery.
Right. And it makes it all the more challenging.
Yeah.
So right now you said she's taking sulpirid for her mood, beta-histin for the vertigo, and she's undergoing physiotherapy.
Right.
But despite all of these standard approaches, she's not experiencing the improvement you're hoping for, and that's where our exploration into these AI-generated ideas comes in, right?
Absolutely.
Yeah.
So the question becomes, can AI, which can examine this vast landscape of medical research,
Right.
offer potential strategies that might complement her current treatment plan and address some of these persistent issues that she's having?
In new ways.
In new ways, exactly. And that's really what the aim of our deep dive today is all about.
Exactly. And so we asked 4 different AI models.
Wow.
KI, ChatGPT-o1, Perplexity Grok 3, and DeepSeek-R1.
That's a lot of AI.
Yeah. It is a lot of AIs, and we asked them to analyze the medical information that you provided and generate suggestions for improving her health. And so our mission today is to present these AI-driven ideas to you in a way that is clear and understandable. And we're going to start with the suggestions that were mentioned most frequently.
Okay.
And it's vital to remember that these are suggestions generated by AI, and they're intended to be discussed thoroughly with her medical professionals.
Right. It's not medical advice in itself.
Right, exactly. It's a starting point for a conversation with her medical team.
Yeah, and it's really interesting that we see this overlap in suggestions
Yeah.
across these very different AI models, which suggests that there are certain approaches that are consistently identified as being potentially beneficial,
Yeah.
given the specific symptoms that she's presenting with.
Right, because it's a unique constellation of symptoms.
Yeah, absolutely.
Yeah, okay. So the idea that came up most often across all 4 AI models was vestibular rehabilitation therapy, or VRT.
Okay.
So let's break that down. What exactly is VRT?
So essentially, VRT is a specialized form of physical therapy
Trey.
that focuses on retraining the balance system.
Okay.
So it works on the principle that the brain is amazingly adaptable
Uh-huh.
and it can compensate for damage to the inner ear
Yeah.
or to the nerves that are related to balance,
Right.
which in her case have likely been affected by the tumor and its removal.
Of course. Yeah.
So VRT provides very specific exercises to help the brain find new ways to process information about balance.
I see. So it's kind of like teaching an old dog new tricks, but with the brain.
Exactly. It's all about retraining those pathways.
So this makes a lot of sense given her dizziness, her balance problems, those involuntary eye movements, the nystagmus, all pointing to vestibular issues.
Exactly. And
Yeah.
so the therapy involves a really tailored set of exercises that might include things like gaze stabilization exercises,
Okay.
where she would focus on a stationary point while moving her head.
Gotcha.
Habituation exercises where she's repeatedly exposed to the movements that trigger her dizziness to help her brain get used to them.
Oh, that's interesting.
Yeah, it's kind of like exposure therapy
Right.
for dizziness. And then balance retraining exercises where she might practice standing or walking in different conditions
Yeah.
just to really challenge her stability.
So it's all about helping the brain find those workarounds?
Exactly. So
Yeah.
the goal is vestibular compensation,
Okay.
which is essentially helping her brain learn to rely more on her other senses,
Okay.
like her vision and the input from her feet and legs.
To stay balanced,
To
really
do-
balanced.
Exactly.
So what are the potential pros and cons of VRT for her particular situation?
So the potential benefits are significant.
Okay.
There's really strong evidence that VRT can be very effective in reducing dizziness
Okay.
and lowering the risk of falls, which is a major concern given her gait disturbance.
Right.
It can also help alleviate motion-induced nausea, which she's experiencing.
So that's a huge potential benefit.
Absolutely. However, one potential challenge
Okay.
is that because her balance issues likely stem from a central cause, meaning the tumor's impact on the brainstem, the improvement might be a little bit slower
I see.
than someone whose problem is just in their inner ear.
Okay.
So it might take a little bit longer, but there's still good potential for improvement.
Whoosh, that's good to hear.
Yeah. And of course, it requires consistent effort on her part.
Of course.
And ideally a therapist with expertise in vestibular rehabilitation.
So finding that specialist is going to be key.
Absolutely.
Did any of the AIs have specific insights about VRT?
Yeah, so ChatGPT-o1 actually provided a very detailed explanation of the different types of exercise.
Mm-hmm.
And it really highlighted the brain's remarkable ability to adapt.
Yeah.
It even mentioned the potential use of tools like balance boards and computer-aided posturography.
What is that?
Yeah, so that's basically a way to objectively measure balance control
Oh, interesting.
and to track her progress. So that's something that could be potentially helpful.
Yeah.
And it also emphasized the importance of taking precautions to prevent falls during the rehab process, because obviously that's a concern.
Of course. Yeah.
Right, and interestingly, it referenced meta-analyses,
Okay.
which are basically studies that combine the results of multiple other studies showing that VRT can lead to lower dizziness scores and a reduced risk of falls.
Oh, wow. So there's good data backing this up.
Yeah, absolutely.
That's encouraging. What about the other AI models?
Yeah, so Perplexity also pointed out that VRT is relevant given the Schwindel, which is German for dizziness,
Okay.
and the balance problems that are noted in her medical report.
Right.
So it described the specific types of exercise that we talked about, like gaze stabilization, balance training, and habituation.
Right.
And it even provided a link to resources from Headway UK
Oh, cool.
that illustrate some of these exercises.
Okay.
It also mentions studies that have shown improvement in balance after brain surgery
Wow.
with the help of VRT.
That's hopeful.
Yeah, and it also underscored the need for a physical therapist that specializes in this area.
That seems to be a recurring theme.
Yeah, it's really important to find someone with that expertise.
Okay, what about Grok 3 and DeepSeek R1?
Yeah, so Grok 3 was very direct. It stated that VRT is likely to help reduce her dizziness,
Okay.
improve her balance, and it suggested looking at information from Johns Hopkins for more details.
Oh, okay.
And also highlighted a case study that was published in the journal Medicine, Baltimore,
Okay.
that showed a 50% reduction in dizziness
Wow.
after 3 months of VRT in a patient with a condition similar to hers,
Oh,
a
wow.
meningioma in the cerebellopontine angle.
Okay.
So that's really encouraging.
Yeah, that is encouraging.
And then DeepSeek R1 offered a really interesting perspective.
What's that?
It suggested combining VRT with virtual reality therapy.
Oh, wow. VR.
Yeah, so it mentioned neuroplasticity, which is the brain's ability to form new connections as the driving force behind this type of rehab.
Right.
And it described how VR systems can create simulated real-world scenarios
Oh, wow.
that can help with gaze stabilization and dynamic balance training.
Because it's like a video game for the brain.
Exactly. It can make it much more engaging.
Right, and probably more effective.
Potentially more effective, yeah.
Yeah.
It even cited a potential 40% reduction in fall risk in patients with cerebellar issues
Oh, wow.
using this combined approach.
Okay.
So it's something to really consider.
Yeah, I'm sure there are therapists out there who are incorporating VR.
Yeah, absolutely. And it also suggested asking therapists about VOR, or vestibulo-ocular reflex retraining,
Okay.
which is another aspect of vestibular rehab.
Okay.
And it noted that Johns Hopkins has used VR in the rehab of meningioma patients.
Oh, wow. So it's already being implemented.
It is.
That's fantastic.
Yeah, it's really cutting edge.
So VRT sounds like a very promising avenue.
Absolutely.
To explore with her doctors, what was the second most frequent suggestion?
So the second most frequent suggestion from the AI was cognitive rehabilitation therapy.
Okay, what is that?
So this type of therapy focuses on improving cognitive functions
Okay.
that may have been affected by the tumor or by the surgery.
Right.
So things like her attention memory processing speed
Right.
and what we call executive functions, things like planning and problem solving.
Oh, right.
So all of those higher level thinking skills.
Right, so that directly addresses that slow to thinking and difficulty concentrating that was in the psychiatric findings, right?
Exactly. And so cognitive rehabilitation typically begins with a really comprehensive neuropsychological assessment
Okay.
to identify her specific strengths and weaknesses.
So it's very personalized.
Very personalized.
Okay.
And then based on that, a trained therapist will develop a program of exercises and strategies.
Got it.
And those exercises can be computer-based, they can be traditional paper and pencil activities, or they can even be real-life simulations.
Oh.
So it really runs the gamut.
Okay.
And the therapy also emphasizes teaching what we call compensatory strategies,
Okay.
like using memory aids or developing techniques for better task management.
Right, tools to help.
Exactly. So the principle behind all of this is to stimulate that neuroplasticity and help her brain find new and more efficient ways to process information.
So it's kind of like rewiring the brain.
Exactly.
What kind of benefits could we see if she were to participate in cognitive rehab?
Well, the primary benefits would be noticeable improvements in her cognitive abilities,
Okay.
which would likely lead to better performance in her daily life.
Okay.
So she might find it easier to focus, remember things, think more clearly and quickly.
Right. So it would really improve her quality of life.
Absolutely.
Yeah.
And it can also help reduce any anxiety or frustration that she might be feeling
Right.
as a result of these cognitive difficulties.
Because it's frustrating
It is frustrating.
when you can't think clearly.
Exactly.
Yeah.
But similar to VRT,
Yeah.
it requires the guidance of a trained therapist
Okay.
and consistent effort on her part.
Okay, so what specific details did the AIs bring up about cognitive rehab?
So ChatGPT-o1 provided examples of different types of cognitive exercises
Okay.
and stressed the importance of understanding the underlying causes of her cognitive difficulties.
Okay.
It mentioned dual task training, which is interesting.
What's that?
So that's where you perform a cognitive task simultaneously with a physical one.
Oh, okay.
So that really kind of challenges the brain
Yeah.
to work on multiple levels. And it also suggested homework activities like puzzles,
Oh,
playing games,
yeah.
right, to kind of reinforce the
And
therapy.
keep it going.
Exactly.
Yeah.
And it also pointed out that if very specific cognitive deficits are identified, referral to other specialists might be beneficial.
Okay.
So, for example, a speech therapist.
Right, or occupational therapist.
Right, exactly.
What about perplexity?
Perplexity really linked cognitive rehabilitation to those slowed thinking and concentration issues
Right.
that were reported in her case. And it described exercises that target different cognitive domains.
Okay.
So attention, memory, processing, speed,
Yeah.
problem solving, executive function,
Wow, so really a whole range.
the whole range. And it emphasized that it's personalized
Right.
and the difficulty gradually increases as she progresses.
Oh, that's smart.
Yeah, it keeps it challenging.
What?
And importantly, Perplexity mentioned that cognitive rehabilitation has been shown to improve quality of life for brain tumor patients.
Oh, wow.
And it can even reduce burden on caregivers.
Right, because the caregivers are also going through a lot, and
Absolutely.
it can be overwhelming.
Yeah. And it provided a link to a research paper on Semantic Scholar.
Oh, great. So you can actually read the research.
Yeah, if you're interested in learning more.
Yeah. Okay. So cognitive rehab sounds like another really good area to discuss with her medical team.
Absolutely.
Now, for third place, there was a tie, right?
There was a tie.
What was it?
So mind-body practices for improving emotional well-being
Okay.
and home modification and assistive devices
To improve safety.
to enhance safety. Yeah.
Okay. So let's start with those mind-body practices. So
Nice.
what do we mean by that?
So these encompass things like meditation,
Yeah.
guided imagery breathing exercises,
Okay.
all designed to reduce stress and improve mood.
And given her depressed mood, this seems really relevant.
Yeah, absolutely.
And I can imagine that reducing her stress would have a positive impact on her physical symptoms as well.
Absolutely. There's this mind-body connection that's so powerful.
Right.
And so these practices work by promoting relaxation, emotional regulation,
Uh-huh.
and activating what we call the parasympathetic nervous system.
Okay, so what's that?
So that's like the body's rest and digest system.
Oh,
It's the opposite of the fight or flight system.
got it.
So it counteracts the effects of stress.
I see.
So the potential benefits include improved mood, better sleep quality, even reduction in pain perception.
Oh, wow.
Yeah, and these techniques are generally considered very low risk,
Okay.
and they can be done at home.
So that's great.
It's very accessible.
Yeah. What specific practices did the AI models recommend?
So ChatGPT-o1 highlighted mindfulness meditation,
Okay.
which includes practices like focusing on your breath,
Right.
doing a body scan,
Okay.
where you bring awareness to different sensations in your body,
Yeah.
and practicing loving-kindness meditation. It also mentioned mindfulness-based stress reduction programs, or MBSR programs,
Right.
and cited evidence that these practices can reduce anxiety and depression and even potentially improve attention.
Wow, that's fantastic.
Yeah, so there's really good research supporting this.
That's encouraging.
Yeah, and it even gave specific examples of exercises,
Okay.
like mindful breathing, body scans, loving-kindness meditations,
Right.
and it even provided links to articles from the Harvard Gazette and a meta-analysis in the journal J Consult Clin Cycle.
Wow, so you can actually read about the research.
Exactly.
That's fantastic.
Nice.
What about perplexity and Grok 3?
So Perplexity really connected mind-body practices to her reported depressed mood,
Right.
and specifically mentioned meditation-guided imagery breath work.
Right.
And it echoed the benefits of reduced stress hormones, improved sleep,
Yeah.
and noted that these practices have been shown to improve mood, reduce pain, and enhance quality of life for people with neurological conditions.
Oh, that's great.
Yeah, and it even linked to an article in the Times of India. So that's interesting.
Yeah, and Grok 3.
Grok 3 suggested gentle yoga and mindfulness as
Mhm.
being beneficial for both mental and physical well-being,
Okay.
noting that they can reduce stress-enhanced mood.
Uh-huh.
It specifically mentioned gentle yoga as being adaptable to physical limitations,
Oh, that's good.
and mindfulness for its positive impact on emotional well-being.
Right.
And it even referenced a study in Frontiers in Psychiatry
Okay.
that showed improved mood and reduced fatigue in a patient with multiple sclerosis.
Oh, wow. So it's applicable to different neurological conditions.
Yeah, it seems to be a common thread.
Right. So it sounds like these mind-body techniques could be a really good way for her to manage her emotional health.
Absolutely. It gives her some agency
Right.
in her own recovery.
Yeah, and it's accessible.
Exactly.
So now let's move on to that second suggestion that tied for third place.
Okay.
Home modification and assistive devices.
Yeah, so this is all about making adjustments to the living environment and utilizing equipment to reduce the risk of falls and make daily activities easier.
Right.
So given her balance issues,
Yeah.
the facial paralysis, which
Yeah.
might affect her depth perception and hearing
Right.
on that right side, and her increased risk of falls, This is really important to consider.
Absolutely.
So we want to make her home as safe as possible.
Yeah. What kinds of modifications and devices are we talking about?
So modifications could
Mhm.
involve things like installing grab bars in key areas, like the bathroom,
Okay.
using non-slip mats in the shower and other slippery areas,
Right.
providing a stable shower chair,
Okay.
removing any tripping hazards,
Right.
like loose rugs or clutter, and then ensuring adequate lighting
Great.
throughout the home, especially at night.
Yeah. That's so important for anyone, but especially for someone with balance issues.
Exactly. And then in terms of assistive devices, we might be talking about walking aids,
Okay.
like a cane or a walker,
Yeah.
to provide additional support,
Right.
adaptive utensils for eating, if the facial paralysis is making that difficult,
Worse.
and even eye protection,
Okay.
if she's having trouble closing her right eye.
Wow. So it really runs the gamut from simple things to more specialized equipment.
Exactly. And it's all about meeting her individual needs.
Right. So what are the potential pros and cons of this?
Well, the biggest advantage is obviously reducing the risk of falls and injuries,
Of course.
right? Which can really impact her recovery
Yeah.
and make things much more difficult.
Yeah.
So that's the main goal.
Right.
And these modifications can also increase her confidence and independence.
Right. Because if she's afraid of falling, she's not going to want to move around.
Exactly.
Yeah.
And so that can be very limiting.
Yeah. So the cons would be what, like the financial investment?
Yeah, so the potential downsides are that it might require an assessment of her home
Okay.
to figure out
Mm.
what modifications are needed,
Right.
and then implementing those changes could involve some cost.
Of course. But overall, it seems like the benefits outweigh the risks.
Yeah, absolutely.
Okay. So what did the AIs recommend about home modification
Hmm.
and assistive devices?
So ChatGPT-01 provided really detailed room-by-room recommendations,
Oh, wow.
and it emphasized having an occupational or physical therapist conduct a professional assessment.
Oh, okay.
Okay, so that's really
And
important.
to get expert advice.
Exactly.
Yeah.
And it highlighted the need for clear pathways, safety measures for stairs,
Uh-huh.
mentioned different types of walking aids,
Hmm.
adapted devices for eating and drinking, and even the benefit of emergency call systems,
Oh, wow.
which can provide peace of mind.
Right.
And it cited information from the National Institute on Aging and a study in BMC Public Health,
Okay.
showing that these measures can lead to up to a 40% reduction in falls.
Oh, wow. That's huge.
Yeah, it's a significant reduction.
Yeah.
And it also made the point that short-term use of assistive devices can actually be a bridge to greater independence.
Right. It's not about making her dependent on these things. It's
Exactly.
about giving her the support she needs now.
Yeah, to regain function and independence.
Yeah. What about Grok 3?
So Grok 3 recommended the use of assistive devices for mobility and safety,
Oh, wait. Oh.
to reduce the risk associated with her gait instability and her tendency to fall.
Right.
And it suggested walkers and canes
Yeah.
and consulting with a physical therapist for recommendations.
Yeah.
And it also underscored the importance of home modifications, like installing grab bars using non-slip mats.
Okay.
And it even referenced the National Institute on Aging and a study in the gerontologist
Okay.
that showed a reduction in fall-related injuries as a result of these types of things.
Okay. So it seems like there's good evidence
Yeah.
that these things really make a difference.
They do.
Okay. It's worth the investment.
Yeah. So creating a safer home environment is a crucial part of her overall care.
Yeah, absolutely.
Okay, so beyond these top 3 suggestions,
Right.
the AI models also came up with a bunch of other health improvement ideas.
Yeah.
Let's touch on some of those, starting with nutritional support.
Okay. So a number of the AI models proposed different nutritional strategies.
So, for example, Perplexity suggested a diet high in protein
Okay.
and anti-inflammatory foods,
Okay.
a Mediterranean diet
Yeah.
that includes brain-boosting foods,
Okay.
and a focus on foods that boost the immune system.
Gotcha.
Grok 3 recommended nutritional support with a focus on brain health.
Okay.
And DeepSeek-R1 suggested an anti-inflammatory ketogenic diet combined with intermittent fasting.
Oh, wow.
So you can see there are a lot of different ideas out there.
Yeah.
But the general principle behind these suggestions
Yeah, okay.
is to provide her body with the building blocks for healing,
Right.
reducing inflammation, which is often a factor in neurological conditions,
Okay.
supporting cognitive function,
Right.
and potentially helping manage symptoms like nausea.
Of course.
So it's really about giving her body what it needs to heal.
Right. And I imagine there were some specific foods that they mentioned.
Yeah, absolutely. So they mentioned fatty fish, rich in omega-3 fatty acids,
Great.
colorful fruits and vegetables
Right.
that are packed with antioxidants, lean protein sources,
Uh-huh.
and foods with anti-inflammatory properties like turmeric and ginger.
Oh, yeah.
So there are a lot of delicious options,
Right.
but it's really important to emphasize that
Right.
while these dietary approaches might be beneficial, it's crucial to consult with a registered dietitian
Of course.
to develop a personalized plan.
Right, because she's petite.
Exactly.
And she has those issues with nausea and vomiting.
Exactly. So it needs to be something that she can actually tolerate.
Right. It needs to be something that works for her.
Absolutely.
Okay, so what were some of the other recurring themes among the AI-generated suggestions?
So ChatGPT-o1 and Grok 3 both suggested the implementation of a comprehensive rehabilitation program.
Okay, so what does that mean?
So this emphasizes a multidisciplinary approach,
Okay,
bringing together physical therapy, occupational therapy, and psychological support.
so it's a team approach.
It's a team approach
Okay,
to address all these different aspects of her condition.
right, the physical, cognitive, emotional.
Exactly, all in a coordinated way.
Right, because it's all connected.
Absolutely.
Yeah.
And research has shown that this kind of integrated rehabilitation can lead to much more positive outcomes
Yeah, that makes sense.
for people with neurological conditions.
Okay.
So it's really about taking that holistic approach.
Right, treating the whole person.
Exactly.
So what about alternative therapies? Were there any of those suggested?
Yeah, actually, acupuncture was mentioned by both ChatGPT-o1 and Grok 3.
Oh, interesting.
So this is a traditional Chinese medicine technique
Right,
that involves the insertion of thin needles into specific points on the body.
right.
And the idea is that it can help manage pain,
Okay.
alleviate nausea, and address certain neurological symptoms, including facial paralysis and vertigo.
Oh, wow.
So while the evidence for acupuncture varies,
Yeah.
depending on the condition being treated,
Right.
many patients report significant relief.
Oh, okay, so it's worth exploring.
It could be worth exploring.
Yeah.
And then yoga and other forms of meditative movement like Tai Chi and Qigong were also suggested.
Yeah, those are great.
Yeah,
Especially gentle forms of yoga.
exactly. And DeepSeek-R1 specifically mentioned adapted forms of Tai Chi,
Okay.
so modified to suit her needs.
Right.
And these gentle exercises can improve balance, strength, flexibility. And they're known for reducing stress and improving mood.
Yeah, I love those.
Yeah, they're really beneficial.
And chair yoga was noted as a particularly accessible option
Right.
for people with physical limitations.
Absolutely.
So that's great.
Yeah, there are a lot of good options out there.
So we've got these holistic and gentle approaches being recommended alongside conventional therapies. It's nice to see that mix.
Yeah, absolutely. It's about having a toolbox of different options.
Right. And what about directly addressing her emotional well-being beyond the mind-body practices?
Right. So psychological support, such as individual counseling and participation in support groups,
Yeah.
was recommended by ChatGPT-O and Grok 3. So therapy, using approaches like cognitive behavioral therapy or CBT,
Right.
or acceptance and commitment therapy or ACT,
Yeah.
can provide her with tools and strategies
Right.
to cope with the emotional impact of this illness,
Yeah.
manage depression, anxiety, and build resilience.
Yeah. Because this is a lot to go through.
It is. Host speaker.